Alliance for Multi-Specialty Research performs clinical trials to support pharmaceutical companies in the development of new drugs, devices, and vaccines. AMR Kansas City's medical director, Dr. John Irvin, has conducted more than 730 clinical trials in the past 35 years. He's now overseeing a COVID-19 study in need of participants. We got a few minutes to talk with Dr. Irvin about the work currently underway. And our first question was the obvious one, right? Why should people get vaccinated?
There's a lot of vaccines that are important. We've wiped out many of the pandemics of the past with the very successful vaccines. Smallpox has killed more people than all the wars in history, and it's completely gone. Polio, which you don't know about because you're too young, we've wiped that out. COVID is the worst pandemic we've had since 1918. Swine flu, which killed more people than the war did. So it's really important, as everybody knows, they're suffering through this, to try to bring this thing under control.
With trial participants needed, we asked Dr. Irvin to share what's going on with his current research and explain how the study vaccines differ from the vaccines that are currently available.
Well, the two most successful vaccines are the Pfizer and the Moderna vaccines, which I think everybody has heard of. And these are kind of a relatively new technology using messenger RNA. The advantage of this is they can be produced very, very quickly. The mRNA that's injected as the vaccine disappears from the body shortly thereafter, so it doesn't hang around. We've had almost an unheard of, initially 95% effectiveness of the Pfizer and the Moderna vaccine. That has now dropped down to about 88% because of the Delta variant, which is more contagious and somewhat resistant. We're worried about this potential resistance. The one that we're studying right now for Arcturus is also a messenger RNA. And in fact, we did a booster trial with it where we would actually boost those people that had had the Pfizer shot. And we're now doing an open label thing. The advantages of this vaccine is that we're also covering a couple of the variants. So 1/3 will get the Hunan version of the vaccine, and 1/3 will get one of the beta variant, and the one will get the alpha variant. So we have, I think this is, we'll get additional information about the effectiveness against some of these new variants that have arisen.
AMR Kansas City is currently enrolling for the COVID-19 vaccine study and several others. Dr. Irvin gives 3 reasons why people decide to participate in those studies.
Always surprised when I get that answer as we ask them why they did. They feel good about that. If we're talking about a healthy volunteer trial, probably the majority of people do it for the stipend that's involved, because with a healthy volunteer trial, they get a stipend for their time and inconvenience, and especially young people, that appeals to them. Plus, they do get the vaccine, which can give some benefit. And then the third reason that people get involved is because they want to be either the vaccine or whatever the medicine involved. They get some benefit. And that's certainly true of the COVID trials. Most of the people that we've had that have volunteered, they could give a darn about the stipend part of it. And of course, I'm sure they feel good about potentially helping humanity. But this is before the COVID vaccines were available, and they were able to get the vaccine and be protected. So those are primarily the 3 reasons.
All great information. And for more of that, and on how maybe you could participate in an MR COVID-19 vaccine research study, just call 816-943-0770 or go to cprkc.com.